Welcome to Native Bidaské, Native News Online's weekly spotlight on the people making news and leading change in Indian country.
On Wednesday, May 14th, the Senate Committee on Indian Affairs held an oversight hearing to receive testimony from tribal leaders to discuss the reductions in health care under the Trump administration. Senator Brian Schatz, who represents the state of Hawaii, former chairman of the Senate Committee on Indian Affairs, is our special guest today. In the last Congress, he served as the chairman, and this year he is now the vice chairman. And they kind of switched positions, he and Senator Murkowski, and they have told us publicly that they are both friends and are working in a nice bipartisan fashion to help Indian country. So welcome to Native Bidaské, Senator. And Senator, during the hearing, several witnesses testified that healthcare services in Indian country are already experiencing serious impacts and that the proposed cuts in the Trump administration budget would have devastating consequences. In some cases, this is quite literally a matter of life and death. What's your reaction to the testimony you heard last week?
Well, we heard from Indian country loud and clear, and we heard from Native people in Hawaii and Alaska that these proposed cuts would really devastate not just individual people's healthcare, but the healthcare infrastructure that people on Native lands depend on. You know, I talked to people at Potawatomi, which is the Native Hawaiian healthcare system, and it would just be tragic. But also across the continent, on the reservation, off the reservation, a lot of clinics, a lot of hospitals would actually close. So it's not just that people's insurance would be eliminated for 14 million individuals, including a lot of tribal members and Native people across the country, but also that the institutions that provide the care would just vanish. And so even when you do have care, you would have to drive many, many hours, or in the case of Hawaii or Alaska, you'd have to get on many, many airplanes in order to access care. So this is just terrible stuff. We're going to fight it, and we're hoping that on a bipartisan basis, we can push back.
Great. Now, you noted in your opening remarks that tribal consultation has been lacking. In your view, what does meaningful tribal consultation look like, and how should it proceed through the remainder of the 2026 appropriations process?
Well, tribal consultation, Native consultation is, it's not some bureaucratic box that you have to check. It is a high principle of talking to leaders in nations and communities with which the federal government has either a trust or a treaty obligation or both. And so it has to be understood in that vein, and not just sort of like, oh, we got to do that thing like it's the National Environmental Policy Act or the National Historic Preservation Act, and you got to do this bureaucratic thing in order to be able to move on to the thing you really wanted to do. Tribal consultation is about listening, and there is just, first of all, I'm not sure they're even meeting the minimum standard, but I think the important thing to remember is that they have to listen. They have to try to get some guidance from Native leaders about what would work for them, because in many instances you're dealing with sovereigns and they have to be treated like sovereigns.
Yes, that's a great answer. And Senator, you frequently speak about federal government's trust and treaty responsibilities to tribes. Do you believe that the Trump administration fully understands or is prepared to uphold these obligations?
No, I don't. And look, I'm not trying to score any political points here, but there's just no evidence that they have any understanding of the relationship between the United States federal government and Native people, the history of it, the law of it, the morality of it, and the sort of current state of play. And so, our job on a bipartisan basis is to try to educate this administration. Again, I'm not trying to score political points here. I hope they get it right, but they just haven't really shown a ton of interest in this. And so we've got a lot of work to do together. But so far, they've been pretty hostile to Indian country.
Yes. And last week, you and Senator Lisa Murkowski, the chair of the Senate Committee on Indian Affairs, and now you're the vice chair, you sent a letter to Health and Human Services Secretary Kennedy outlining your concerns about the existing funding reductions and the proposed HHS reorganization, which could significantly reduce healthcare access to tribal communities. Senator Kennedy often cites his family's longstanding commitment to tribes and express a willingness to work closely with tribal nations. Do you believe he has the influence and the resolve to resist pressure from the White House and protect Indian countries?
I have no idea. He has expressed a willingness and an interest in engaging with indigenous communities, but this is we're not in a debate. We're not on a talk show. He's in charge of the department, and so if his department is harming Indian country, it is an interesting historical fact that his uncle and other members of his family had a good relationship with Indian country and Native people across the country. But, the proof is in the actions that he takes. And so I'm hoping that the rhetoric and the actions start to line up. I'm trying to make sure that he has all the information necessary to make the right choice. But, saying the right thing is great. But once you're in charge, you have to do the right thing.
Yeah, I agree with that. And your office last week released information about a new tracker showing that the Trump administration is blocking over $430 billion, that's with a B, in federal funds, including nearly $316 billion earmarked for Native communities. What have you learned from this tracker about the impact on Indian healthcare, tribal healthcare specifically, and how can people who are affected by these freezes share their stories?
Well, look, I think what Trump is doing is hurting people everywhere. But as usual, if something is harmful on the healthcare side or on infrastructure or on economic policy, it usually hurts Native people more acutely. And I think that is the case here for sure. Look, we've got to change the politics here. I think, it's understandable to want to sort of be in good standing with whomever is in charge of the federal government. But right now, it can't get much worse than trying to eliminate programs, cutting billions of dollars, causing layoffs, and then trying to kick people off of Medicaid. And so it's go time. We got to raise our voices here and make sure that folks know that there's a political constituency that used to be bipartisan for taking care of our trust and treaty obligations and being humane to Native people across the country.
Yeah, and you mentioned a couple of times now bipartisanship, and that's my next question. It deals with it. Historically, there's been a long bipartisan support in Congress for Indian country. Do you believe that the bipartisan backing will be enough this time to preserve essential programs for tribal communities?
Not if Republicans don't hear from their tribal members. I think it is still possible, but I don't think we should assume that all of our Republican friends and champions are willing to stand up to the Trump administration on these questions. So, we're all politicians. We need to hear from our constituents, and I think that's part of the strategy here.
Yeah, and that was really my final question. Is sending a letter, emailing, calling, is it still an effective way for tribal citizens to reach their members of Congress?
Yes, absolutely. We are still, almost every member gets a weekly update on the number of people who called or emailed or, tweeted or filled out a form and what they wanted to tell their members. So if the office is any good at all, they are counting the number of people in their community, in their district, or in their state that care about a thing. So, never doubt that you can make a difference. You really can.
Yeah. Senator, that's all the questions I have. I want to thank you for all your hard work. And I know you've been a member of that Senate Committee on Indian Affairs, and I've admired the work you do. And from Native News Online, we really appreciate it. Thank you.
I appreciate you. Thanks very much.
We've heard from Senator Brian Schatz, the Vice Chairman of the Senate Committee on Indian Affairs. And we thank the Senator for stopping by today and talking to us about this high priority. And we can't emphasize enough how important it is for tribal citizens, tribal leaders to send letters, emails, and even call their congressional offices. This is a critical time for Indian country. We cannot afford to have the loss, the reduction of healthcare dollars coming from the federal government. And in a time they really should be increasing, they are decreasing. And so this is a critical time. Chief Miigwech for spending time with us today for another Native Bidaské. Next week, we will have another guest. And as I like to tell you, the elders, please take care of those young ones. The young ones, give your elders hugs. We're all in this together. Chief Miigwech, see you next week.
Thank you for joining us. If you value our warrior journalism for Indian country, please consider supporting our work by scanning the QR code or visiting the link below. Please subscribe to our YouTube channel, follow us on social media, and sign up